how do you think social media has affected plastic surgery?
It's improved my capabilities of picking up new dance moves that are trending. I don't really use it for, I mean, marketing, like the first few people using it, they got pretty ridiculed by the society and everybody. And now it's the norm. Like you have to
like
do it.
Dr. Miami and
he really kicked it off, but he got a lot of crap from members in the society, you know. Like I didn't like everything he put out or a lot of stuff people are doing now. I'm not a huge fan of it, but I'm not like, oh, you shouldn't be doing this. Whatever, you can do whatever you want. Yeah. Just be safe. Like don't put people harm's way, but it's a form of entertainment. That's how I see it. Like some of it's informative, some of it's just strictly entertainment. And it's okay. It's just new platforms and how people use it.
What about like how it shapes perceptions?
I think that's personal and how you want to depict yourself. I can be whoever I want to be on Instagram and be somebody different on Twitter and be somebody different on YouTube. You definitely want consistency and something that clicks with people. But when it comes to perception, it's like the same thing with like when you're in consultation with a patient, it's the same thing as what you're going to be doing. Like I'm not going to go act like a lunatic on Instagram and then try to be like, oh, I know you have breast cancer. I'm very sorry. And then go flossing on like, like a video reel. So it
actually helps the business just in general because you can market yourself and the patients kind of get to see your personality. And when they meet you, you know, they're already kind of sold on it anyways. So all in all, I think it helps out the plastic surgery world. There are pros and cons to it, but you do you on whatever platform you're on. So, and that's what I tend to be on. And like one of the main things is a lot of people ask me to be on podcasts because they ask me for health advice, especially with the whole longevity stuff that I do. And I spit off like a whole bunch of stuff they should be doing. And like people want to hear more and more of that stuff than even the plastic surgery stuff. And I it's a whole new thing that I picked up like 2 years ago. That's just like I've been really passionate about. And I think I've been able to help a lot of people out with the way we do weight loss and everything, even before like going the surgical route, I think helps in a lot of different ways. And even post-surgically, we're able to help patients out and improving their diet, like supplementation, or even like we do hyperbaric treatment, ozone treatments. We have all these other treatments and trying to get red light treatment and some other fancy products in our office.
He's cranked a lot of research.
Yeah.
Like he's my go-to resource. Like anytime I got a question about it, I give a quick phone call because it's way faster than like researching, just because I respect how much I've seen him like research all this stuff. And even at like the national, international conferences about like longevity, wellness, like I know I'm comfortable in like the plastic setting, but going over there, I'm like, oh God, this guy knows this, that guy knows this. And then just hear him talk about it. It's like, okay, you should be on stage. And the way we're implementing it.
How are you implementing?
It all comes down to wellness, overall health, because you can operate on anybody to try to make them feel better. But if you're not emotionally and mentally like in a good place, that can have downstream effects with your surgical outcomes. Not even if you have the best outcome, no wounds, really nice aesthetic results. If you're not like ready to emotionally to go through that stress, it's a lot of stress for your body to heal, and you're not going to respond to it optimally. So we try to make sure everybody's like optimized going through it. It's hard to pick everybody out and what's perfect for everybody, but I think we're pretty adamant, right, about making sure we get the best protocols set for each person. It's not just about, okay, cut a chunk out of your belly, close it up, it'll look better, you'll feel better. There's a lot more to that. And it's just not just the patient, it's the patient's family and support system too.